Hello, everyone. I hope everyone is having a great day, and thank you so much for joining this presentation. I am Melissa Fotinos, and before we get started, I do want to take this opportunity to thank the Interstitial Cystitis Association for inviting me to speak on this very important topic on understanding healthcare coverage for your IC condition. So for this presentation, we're going to be starting with a speaker introduction. We're going to define chronic conditions, discuss different options for healthcare coverage, and then we'll close out with some helpful tips. I do want to take a moment to introduce myself so you know who is delivering this education. As you can see, a majority of my education is in the psychology and counseling field. And I actually did work as a licensed mental health therapist for a few years and also taught counseling at a college level before gearing my career more towards the business sector of healthcare. I did start to become more involved in physician and medical billing compliance as an auditor, which I've been a part of for well over a decade now. During that time, I have audited a variety of specialties, including urology, physical therapy, oncology, just to name a few. So I do have experience in every area at every level of the healthcare revenue cycle. I am certified through the American Academy of Professional Coders as a certified professional coder or CPC, and I'm also a certified professional medical auditor or CPMA. I currently work as a compliance auditor and educator for a national chain of oncology practices, and I'm also a doctoral student at the University of Indianapolis where I study health science. So let's first start by defining chronic conditions. The Centers for Disease Control and Prevention, or the CDC, tells us that a chronic disease lasts longer than a year. It requires ongoing medical attention and/or they limit daily activities. So some very common examples of chronic diseases that I'm sure most of us have heard of are diabetes, arthritis, asthma, and so on. So how is IC a chronic condition? Well, it does last longer than a year since there can be periods of remission or flare-ups over time. It often does need routine medical attention, such as physician or specialty visits, medications, physical therapy. There may also be other services like surgeries. And it also limits daily activities with side effects of frequent and excessive urination, also discomfort and pain in the pelvis or bladder, all of which can impact your job. It can also have impacts on social events as well as sexual activities. So why am I taking the time to define chronic conditions in a healthcare coverage presentation? So when you have a chronic condition like IC, where you may be going to a doctor on a regular basis or physical therapy, or you're taking some type of medication daily, it's very important to have a good understanding of healthcare coverage to protect you from hefty medical expenses. And by having this knowledge, it can help to save you time, stress, and money, as we're going to be discussing later in the presentation. So what are your options? In this section, I'm going to be discussing an array of coverage options from an employer's insurance and COBRA to Medicare, Social Security disability, also to purchasing an individual policy and more. So we're going to dive into that now. So the most popular and obvious option is health insurance that's offered through your employer. There is likely to be more plan options at a lower cost with a larger employer. And the opposite is typically true for a smaller employer who may not have as many options and the cost is usually higher. That's because more people or employees that are buying into the plan, the less expensive it's going to be. I did include here some reminders. The more people that's on your plan, the more expensive it will be. So it's going to be more expensive to have you and your spouse, or even you, your spouse, and your children versus just yourself on the policy. The other thing to keep in mind is there are often enrollment periods and deadlines when you're signing up for insurance through an employer. unless there is a qualifying event, such as divorce or the birth of a child, for instance. If your IC condition has limited you to part-time work, do keep in mind some employers do offer healthcare coverage for part-time employees, such as Starbucks, IKEA, Costco, just to name a few. A lot of times people think health insurance is only offered for full-time employment. And while that is true in most circumstances, again, there are some employers out there who do offer part-time workers healthcare coverage, so it is definitely worth asking about. COBRA is another option which allows for employees to temporarily maintain their employer's healthcare benefits. Typically, this is the same plan and coverage you had as an employee, but you can expect to pay more out of pocket. That's because the employer will not pay towards your premium as they would while you are an employee. Even though you're paying more, it is often better coverage as well as less expensive than individual policies that you purchase. And COBRA is more likely to cover pre-existing conditions like IC, whereas some insurance policies that you purchase may not cover chronic conditions or pre-existing conditions like IC. It's important to remember that there are qualifications for both you and your employer to meet in order to be covered under COBRA. So your employer must have employed at least 20 people for at least 50% of their business days. As for you as the employee, there must be some type of qualifying event, such as a reduction in work hours. Say, for instance, you are moved to part-time, but your employer only offers health care insurance to full-time employees. You may qualify for COBRA coverage. Or if there is termination of employment, whether that is voluntary or involuntary, just as long as it is not termination due to misconduct of some type. Now, if your coverage happens to be through your spouse's policy and they are terminated, say voluntary or involuntary, maybe they're moved to part-time work, maybe they unfortunately pass away, or there is divorce or a legal separation and your coverage is terminated, you may also qualify for COBRA, so keep that in mind. There are also time factors to be aware of when we're speaking of COBRA. Once your employment is terminated, your employer will notify the insurance policy, and typically your plan is terminated almost immediately or within just a few short period of days. But you do have 60 days in which you can elect COBRA coverage. As for length of coverage, COBRA offers coverage for up to 18 months unless there is another qualifying event, in which coverage can be extended to upwards of 36 months. And I did offer an example here. If your work hours are reduced, say you're moved to part-time, you elect COBRA, but then you're laid off, the layoff is going to be a second qualifying event, and that could extend your COBRA coverage for up to 36 months. If an employer's policy and COBRA are not a good fit, you may want to consider your partner's healthcare policy, but there can be some pros and cons with this. Again, as I mentioned earlier, the more people on your policy, the higher the cost. And usually with an employer's policy, there will be a set enrollment period unless there's a qualifying event. However, I will say that even though you may be paying more, it is usually less expensive than COBRA and some individual policies that you may purchase. Something else to consider is that more and more insurance policies are covering couples who are not married or homosexual partners. Some states still recognize common law marriages, and some insurance policies may cover you and your partner if you qualify as a common law marriage. Now, oftentimes the insurance policy is going to have their own definition of marriage or partnership, so it is worth asking if you and your partner are not married. IC can be serious enough to keep you from being able to work, so you may qualify for Social Security Administration or SSA determination of disability. And as of 2002, the Social Security Administration officially actually recognized that IC may qualify as a disability. So you want to keep in mind that applying for disability can be a long process. There are multiple forms to complete and to submit, so it's important to not delay the process. Now, if you are determined to be disabled, you do automatically qualify for Medicare, but coverage does not start until 2 years after the determination is made. So that means it's going to be very important for you to have a backup plan for coverage during that time. Now, you can extend your COBRA coverage for another 11 months beyond the 18 months that I spoke about earlier, but there's going to be requirements that you have to meet. The first one is you must get a ruling from the Social Security Administration that you become disabled within 60 days of your COBRA continuation. The other requirement that you would need to meet is notifying your COBRA plan of the Social Security Administration's disability determination within 60 days of the ruling and before the 18 months of COBRA continuation has ended. So in total, your COBRA may then extend for up to 29 months. So now we're going to delve into what to look for when purchasing an individual policy, and we're going to start with some terminology. These are terms that you're going to hear me mention throughout the remainder of the presentation, and these are also terms you are likely going to encounter while you're researching an insurance plan to purchase. Medical billing and insurance is often confusing and it has its own language. Many times people will use the terms that you see here interchangeably to mean the same thing, but there are differences between them. So a premium is the cost that you pay per month to keep your policy active. On the other hand, a copay is what you can expect to pay each time you have a certain service. Sometimes there is a copay to see a doctor, for example, a specialist, but there may also be copays for other services such as physical therapy, even emergency room visits. A deductible is the amount you have to pay before your plan starts to pay any cost towards your medical care. Once your deductible is met, your policy may have a coinsurance or percentage that you are responsible for. 80/20 or 90/10, these are very popular, though it can sometimes differ. I have seen some policies that have 70/30 coinsurance. An out-of-pocket amount is the amount you are expected to pay out of your own pocket. So some policies may allow for this to be a combination or a tally of all your copays, coinsurances, and deductibles. Usually, once the out-of-pocket is reached, your policy will pay 100% of services as long as they are covered benefits with your policy. Important things to remember here. Typically, the lower the monthly premium or your monthly cost, the higher the deductible and out of pocket. It's important to remember that your plan will not start paying a higher sum towards your medical cost until your deductible and your out of pocket amounts are met. So this means if your deductible and out of pocket amounts are high, you could be responsible for paying a lot of money until your plan starts providing any type of coverage. So if you anticipate an upcoming surgery, procedure, or other type of hefty medical cost, you may want to consider a plan with a higher premium, but a lower deductible and a lower out of pocket so that your plan will start covering a larger amount sooner. Now, throughout the presentation, you have probably heard me use the words or phrases like usually, typically, most likely, and you're probably going to hear me use them throughout the remainder of the presentation. That's because of the first sentence that you see listed here, and that is no two insurance plans are exactly alike. I cannot stress that enough. I have often heard patients say, well, my last plan covered it. I don't understand why it's not covered now. Or my friend has the same healthcare insurance company that I do and it's covered. I don't understand why it's not covered for me. Keep in mind that payers may differ in their guidance and policies, even if it's the same healthcare company. So, for example, what's true for Blue Cross Blue Shield of Florida may not necessarily be true for Blue Cross Blue Shield of Virginia. As an example, one plan can cover a service or medication, whereas another one may not. Another example, one plan can cover a diagnosis or condition, but another plan may not. And in some cases, some plans may not cover a certain service or medication at all. As an example, your physician has ordered physical therapy for your IC. Your plan may offer PT as a covered benefit, but it may only cover it for certain diagnoses, one of which may not be for bladder or urological conditions like IC. They may be more amped to cover PT for a patient who had a hip replacement, for example. So if you ever have any doubts or concerns about your coverage, it's best to contact the insurance company. Their telephone numbers are often listed on the back of your insurance card, and most of them will have websites with contact information listed, and also most of the time they make their policies published to the public. Before contacting the insurance payer, I do recommend to arm yourself with as much information as possible, such as codes. So what do I mean by codes? There are codes for just about everything in healthcare, and this is how your hospital and your provider's office communicates with your insurance plan on what was performed, so the service, and why it was performed. So this will be your diagnosis or your condition. ICD-10 codes are going to be used for signs, symptoms, and diagnoses, whereas CPT, or what we term HCPCS codes, are used for procedures, surgeries, medications, and other services. So anything that's not diagnosis or condition related. Now, is it an absolute requirement that you have these codes when you're contacting an insurance payer? No. So I don't want you to think you absolutely have to have these codes before you can even contact your insurance payer. But I do recommend it because this is the language the health insurance company speaks. And if you're armed with that information, it's going to make speaking with them easier as well as quicker. Your best bet is to contact the billing office at your practice. I do suggest not using the internet because of two primary reasons. The first is it may not be a credible website since we don't know the credentials of the person that provided that information on the website. The second reason is we don't know how up to date the information is. You do want to remember that codes can change every year. These codes are added, deleted, revised, updated each year. So if you jot down or note any of these codes, these could have changed with these yearly updates. So you do want to make sure that you do have the most current and up-to-date codes and information. And typically your billing office is going to have that information. Now, I do want to turn our attention to some important considerations. A majority of the time when selecting a policy, people will often ask how much is my premium or my monthly cost, or they may ask how much is my copay to see my physician. It's important not to settle for a plan just because it's the least expensive option. While cost is certainly an important factor, especially if you're on a budget like most of us, there are also multiple other things that you'll need to consider that I'm going to be covering over the next two slides. So we're going to start with referrals. Some policies will require a referral from your primary care physician for you to see a specialist. And this is going to be important for patients with IC because oftentimes you will see a specialist such as a urologist. So if you have a plan that requires a referral, it will require that you have both a primary care physician and on top of that, any specialist that you may need to see. Now, if your policy does not require referral, you do not necessarily need to have a primary care physician. But of course, that will be up to you and whatever is best for your healthcare needs. This is going to save you a copay and time because you would need to see your primary care physician first, wait for them to write the referral, and then send that referral over to the specialist, and then you would need to call to schedule the appointment with the specialist. All of this can slow down your process of care, and where you're having pain and discomfort like is common in IC, you're going to want to be seen as soon as possible. Other important things to keep in mind when we're speaking about referrals. They are usually only approved for a certain number of visits, which can be as little as one visit. Very rarely, if ever have I seen referrals that are approved for an indefinite number of visits. And they often also have time frames. It's important to keep track of these visits on a calendar because some specialists may not see a patient without a referral. So this means that you may have to reschedule your appointment. And if they do see a patient without the referral, the insurance policy will likely deny that claim. What this means is you could be possibly billed for that visit. The insurance company will most likely not be in contact with you to let you know you need a referral, or you may need another referral if you have exhausted your visits. And sometimes the practice may not even notify you. For instance, they may not have the employee bandwidth or enough employees to contact the patients, or they may not have time due to very large patient caseload. So it's important for you to keep track of this. Authorizations are another important consideration. Some insurances may require authorizations or approvals for certain services, supplies, or medications. So like I just discussed with referrals, some practices or hospitals may not provide a service without that authorization. And if they happen to perform it without the authorization, the claim is likely going to deny. That means that you could be billed for that service. I do want to emphasize that authorizations do not guarantee payment. Oftentimes, if a claim is denied, that is going to be the first defense a practice or a patient has. But I had an authorization. The insurance company can still come back and deny the claim. It could be for a number of different things, such as the physician's documentation, or maybe the payer did not have all the documentation or all of your records that they needed to process the claim. But it is less likely to be denied if the required authorization is on file. So think of an authorization as permission to have a procedure or medication rather than a guarantee of payment for that medication or service. Authorizations and referrals are sometimes confused with one another. Referrals usually pertain to office visits, whereas authorizations will typically pertain to services, procedures, medications, and things of that nature. If you need to know whether your policy requires referrals or authorizations, I do recommend to contact the insurance payer directly, or you can also research on their website. Some may have that information published for anyone to view. I do highly recommend to call the practice prior to your visit to ensure your referral and/or authorization is on file. Practices may not always have the time or the ability, such as a shortage in staff, for instance, to let every patient know this information. It's best not to assume that everything is taken care of. Considerations do not stop with referrals and authorization. So if your policy does not require either of these, you may think you are good to go. But there are some other important considerations that you need to be mindful of. And we're going to start with coverage caps. This is where an insurance plan limits or restricts the number of times you can have a service, and this may also be within a certain time frame. A good example here is physical therapy. With some plans, they may not require a referral or authorization for physical therapy, but they may have a policy in place where you can only, for example, have 20 PT visits within a 3-month time frame or something similar to that. Now, if you exceed these visits, you may be billed for the excess visits. So it's important that you're keeping track of your visits on a calendar of how many you've had, or if you're getting close to that cap amount, because your insurance payer or your office may not be able to notify you of this. Keep in mind that some services may be considered experimental or investigational. So what exactly does that mean? It usually pertains to a new medication or a new technology where there is not yet enough research to fully support the effectiveness or the success of the service or medication. A good example here is a new drug that is currently under FDA review, or say it was just approved by the FDA. Insurance plans typically will not pay for medications or services that they deem as experimental or investigational. So it is important that you're contacting your insurance payer to see if a service is covered or if a medication is covered. Lastly, remember that your insurance policy may not be accepted by all practices and hospitals. So when you hear the term out of network, that means your physician, practice, or hospital does not accept your insurance policy. So it's important not to assume just because you have insurance, it's going to be accepted everywhere and you can be seen anywhere. Technically, you can, but you can expect to pay more. Some plans may offer some out-of-network benefits, but it's typically going to be at a higher cost than if you're seen somewhere that is in-network or that accepts your insurance. Some plans do offer some out-of-network benefits, but some do not. So if you're seen by a physician that does not accept your insurance and you have no out-of-network benefits, you are likely going to be 100% responsible for that visit or service. So what happens if your claim is still denied? The strongest advice that I can offer here is do not give up, as there are options. Many times patients feel defeated or they may even go ahead and pay the bill. My advice here is to ensure that all the options are exhausted. Typically, when a claim is denied, the billing office at your practice or your hospital submits an appeal with the insurance company, and this is done in hopes of overturning the denial. If the claim is still denied, some insurance payers may allow for a second appeal with review of your medical record or documentation from your physician. When appeals are still unsuccessful, your physician may do a peer-to-peer review or consultation in which they speak with the medical director at your insurance company. Your physician may also want to write a letter of medical necessity on your behalf to explain why the service or the medication is needed for your IC condition. When all of these options are exhausted, you as the patient may have to speak with the insurance payer to inquire about your options. So think of that old saying, the squeaky wheel gets the oil. So in other words, the squeaky wheel gets the attention. So the more you advocate for yourself, this may help to overturn the denial. And in some cases, it may not, but at least you will know that you have exhausted all of your options. So let's take a look at the most common types of insurance policies. HMO stands for Health Maintenance Organization. These can be attractive options because typically they will have lower copays and lower premiums. However, the deductibles and out-of-pockets are usually higher, and they also usually require referrals and authorizations for many services. So remember, when your deductible and out-of-pocket amounts are higher, that means you're going to have to pay a lot more towards your medical expenses before your plan truly starts to kick in. PPO is preferred provider organization, and these typically will have higher monthly premiums, but the deductible and out-of-pocket amounts tend to be lower, and these plans usually do not require referrals, but they may still sometimes require authorizations for certain services. Another advantage to PPOs is they will usually have more out-of-network benefits because sometimes your only choice in your area may be to see a physician who may not participate or accept your insurance. Even though it may seem like you're paying more per month with the PPO policy, you will be able to reach your deductible and out of pocket sooner since these are lower, so that your plan really does start to pay more towards your expenses at a sooner rate. POS stands for point of service, and these policies aren't as well known as HMOs and PPOs, but they do usually combine elements of both HMOs and PPOs. Like HMOs, they will typically require a referral, though not all, and may also require authorizations for certain services. They offer some benefits if you are seen out of network, but I will say be prepared to pay higher copays and higher out-of-pocket amounts if you are seen by a physician or practice that's out of network or that does not accept your insurance. Another disadvantage that you may see with POS policies is if you're seen out of network, some of these plans may require the patient to submit all the necessary paperwork to the insurance company. And on top of that, some of these policies may be more beneficial if you're receiving all of your care in network, but that means you will be limited on where you can receive your care. The next type of policy I want to make you aware of is short-term policies. These are temporary policies. They may seem appealing to most people because typically they will have lower premiums and they can provide short-term coverage in case you're in a pinch or a jam. Say you're in between jobs and you just need to see your primary care physician or your specialist for an office visit. Also, with these plans, enrollment is often very flexible. You can register at any time throughout the year, so there's not that defined enrollment period like we typically see with other policies. However, they can have many disadvantages, especially for those with chronic conditions like IC. These types of policies will typically only cover a small amount of physician or even emergency room visits or urgent care visits for just a few months. Because of this, their benefits are very limited. So coverage for services like physical therapy or surgery, or even with some medications, may not be covered at all, which means that you will have to pay out of pocket. If additional benefits are offered, a lot of times there's going to be limits or coverage amounts that we spoke about earlier, in addition to requiring authorizations. Another drawback to these types of policies is chronic and pre-existing conditions like IC are typically not covered. That means if you are expecting an upcoming procedure, or even if you depend on a certain medication on a routine basis, these short-term temporary policies may not be your best option. These are typically the best option for someone who is healthy and may not require routine visits, services, or medications. Okay, so you have exhausted all of your options. What do you do now? I recommend to contact the practice or the hospital's billing office. They will often employ financial counselors that can help you to set up a payment plan that fits your budget, or they can also help you to apply for other types of assistance or financial aid. I have also seen plenty of practices that offer discounts to patients who are self-pay, so patients that don't have insurance and they're paying out of pocket. So it is definitely worth asking. You may also want to consider consulting with an insurance broker. However, I do recommend for you to choose wisely by comparing different brokers. You'll still want to do your homework and research the things that I've discussed throughout this presentation because although brokers are extremely helpful, they may not know certain aspects of the policy, those aspects that we've covered in this presentation. So in other words, they might not know all of the fine print. So you still want to do your homework and research. So we did have some questions that came in, and I do want to take the time to answer some of these questions as time allows. So the first question is, does Medicare cover pelvic floor therapy? So those that may not be familiar, pelvic floor therapy will fall under physical therapy benefits. I will start by answering yes. Typically, Medicare does cover physical therapy. However, as we have seen in the presentation, questions about insurance and medical billing are rarely, if ever, answered with a simple yes or no. There is typically often other considerations that need to be factored in. The first for Medicare is location. Location is very important with Medicare because coverage for certain services may vary from region to region. So what's true for a California jurisdiction or location may not necessarily be true or the same for a jurisdiction in New York, for example. These jurisdictions are known as Medicare Administrative Contractors or MACs, and their policies are often referred to as determinations. So even though Medicare will typically not require authorizations for services like PT, they may have determinations in place that will explain the diagnoses that are covered, as well as any time frames or cap amounts like we discussed earlier in the presentation. Now, sometimes you may go beyond any cap amount. Say, for instance, your jurisdiction only covers 20 visits in a 2-month time span, but you may need PT for a longer duration, or you may need additional visits. When this happens, your practice may have to submit additional paperwork to explain why more visits are needed for your IC condition. Sometimes Medicare may cover the extra visits, but if they don't, and you as the patient still want to proceed with the visits, your practice may have you sign an ABN. This stands for Advanced Beneficiary Notice. And this explains to the patient that Medicare is no longer going to pay for that visit. In this case, they may no longer pay for PT, and you will be responsible for the amount due. Now, I did include a note there at the bottom of the slide about Medicare replacement policies. I have noticed with some patients, they may have one of these policies and still refer to it as just Medicare. The answer that I have provided here to this question is for what we call straight or plain Medicare versus Medicare through a major carrier like Anthem, Blue Cross Blue Shield, or United Healthcare, which can vary greatly in their policies, including for PT, some of which may have a lot of restrictions or require authorizations or referrals. So Medicare and Medicare replacement policies, or Medicare supplemental policies, keep in mind these are not the same thing, so they should not be used interchangeably to mean the same thing. So with question 2, does health insurance cover the cost for a caretaker? So with this question, I'm going to assume it's referring to an at-home nurse or an at-home nurse's aide. So there are codes for this service, which means it is a legit service. So if there were not codes, it would mean that this service is not recognized at all through any insurance payer. I would recommend to contact the physician's office to obtain the most up-to-date codes that fit this particular situation that you're speaking of, and to check with the insurance payer to see if it's a covered service and what the policies are around it. Again, I'm going to emphasize plans can differ. I have seen some policies that cover at-home visits, while I have also, in my experience, seen some plans that do not cover at-home visits. And if it is covered, payers are typically going to limit the amount of visits per month or even per week. Oftentimes, a physician will need to write a letter of medical necessity to explain to the insurance payer why a patient needs a caretaker or at-home services. Another consideration is policies will generally only pay certain services to be performed at home and would typically state which healthcare professional is allowed to provide care to the patients at home. So in other words, if you're caring for a loved one or a friend, an insurance payer will typically not cover this. Typically, it's going to be covered only for qualified medical professionals. So with the third question, how do I see BPS patients get the services they need their insurance company to pay for to get approved? So really the answer to this question is something that I spoke about throughout the presentation, and that is know your policy and what they cover. Many times when a claim is denied, it's because the insurance has stuck to or upheld their policy. So if their policy clearly states it is not a covered service or not a covered diagnosis, it will probably still deny. Now, sometimes they may, though it is rare, overturn a denial, or they may bend or flex their policies, but that's usually when the physician or patient becomes involved to explain why the service or medication is needed. So in saying that, it's not always the payer. Sometimes the patient and the physician have to become involved. So remember what I was saying earlier, squeaky wheel gets the attention. If all else fails with your current policy, you may need to look for a different policy. If you know a certain medication works best for you, but it's not covered on your current plan, or if your physician has recommended a service that they feel certain is going to help with your IC condition, but say it's not covered under your current plan, you may need to research different plans to see if it's a covered benefit with another plan, especially if you know the service is going to be a hefty cost, like if it's a surgery or if it's a medication that you know you're going to be taking for a long time or even indefinitely. If you do decide to keep the same policy, or if it's the only option that you have and the insurance still is not paying, I do recommend to reach out to the billing office at your practice or your hospital. Like I was saying before, they can often set you up on a payment plan. They can help you to apply for assistance, or even give you a discount because you are a self-pay patient. Okay, so to close out the presentation, make sure that you do your homework and research and compare your options. As we've seen in the presentation, there are a lot of options out there, so make sure that you're weighing all of them and not just settling. Remember that plans often have their policies that are published online, or it may be easier for you just to give the insurance payer a call. Don't be afraid to ask questions and to speak up. So, in other words, be your own advocate. If there's something that you don't understand or if there's something that you need to know, do not hesitate to reach out to your medical practice or the insurance company. And sometimes you may have to reach out multiple times, but in the end, if your service or medication ends up being covered, or even if it's partially covered and paid for, or if you get some kind of a break or a discount, it is going to be worth it in the end. I do want to thank you all for listening in on this presentation on understanding healthcare coverage. I do hope you all have a wonderful day. Thank you.